Hello everyone, this is Miss Freddie again. Welcome to my channel. I hope you will like and subscribe to my channel. Today we are going to talk about COVID vaccines and what to expect when getting a COVID-19 vaccines. Okay, right now in the United States, there are two companies that obtained emergency use authorization. That also, you can hear that it's also referred to as EUA. One of them is the Pfizer BioNTech, and then the other one is the Moderna vaccine. So both of these are mRNA vaccines, which means that both contains the genetic information that tells our cells to make the part of the spike protein found in COVID-19. So once our body sees the protein, it'll produce an immune response and our body will begin making antibodies. So don't freak out because the mRNA strand does not enter the cell, the nucleus of the cell, nor does it affect your genetic material. So your genes are not going to get affected, okay? So the mRNA vaccines, the Pfizer BioNTech, you get 2 doses, 3 weeks apart. Usually you get it between 17 to 21 days, for the second dose. The other one is the Moderna, which is, you also get 2 doses, but it's 28 days apart. Okay. Okay, who should not get vaccinated? The CDC recommends that for people that have like severe allergic reaction to a lot of stuff, maybe they should not get vaccinated. If you still insist to get vaccinated, despite of you having a lot of allergic reactions, please make sure you talk to your provider, talk to your doctor. We'd like everybody to get vaccinated, but we also want everybody to be safe. We don't want anybody having severe allergic reactions, okay? Okay, so right now, since these vaccines are pretty new, it is recommended that they should not be interchangeable. Meaning, if you took Moderna vaccine on your first dose, you should not take Pfizer vaccine on the second dose. That's why it's probably important to ask if you go into those mass vaccination center. It's probably better for you to ask what kind of vaccine you're getting, just in case you want to take the second dose in another area. For example, they ran out of vaccines in that area and you want to go to another vaccination center, but you want to make sure that they have the same brand of vaccine. Okay, and CDC also recommends that there should be a minimum interval of 14 days before or after administration of any vaccines. So, for example, if I take the COVID-19 vaccine today, I should not have gotten any kind of vaccine 14 days before, and I should not get any kind of vaccine 14 days after. Now, if you are having some kind of immunization series, which necessitates for you getting maybe the next dose in less than 14 days interval, please make sure you talk to your provider to make sure that it is okay. All right. Okay, common side effects. So just like any other vaccines or any other medications or something, everything has their side effects. So with the COVID-19, the most common ones would be either pain, swelling, itchiness, redness at the injection site. You also feel, fatigue. You feel really, really tired. You get a headache. It can be mild. Some people report, moderate headache. You can have muscle or joint pain. Some people have body aches. You have chills. You have fever. not really high. A lot of people just have low-grade fever, nausea, and or vomiting. So some people have both, diarrhea, swollen glands. So, and a lot of the time, the side effects, most people would describe it as, it feels like they're getting the flu. It seems like, so they just feel like a flu-like symptoms. That's how they describe their side effects when they get it. But don't worry, because a lot of the times these side effects, they'll go away either the next day or the second or third day. So you will experience more of these symptoms after the second dose usually. A lot of the time you just have like pain on the injection site, or just a little bit headache or fatigue. But on the second dose, a lot of people have reported like having diarrhea, nausea and vomiting, and all the really, really tired and joint pains, tired enough, and enough for them to miss like a couple of days of work. So just be mindful that in the second dose, you might experience a more intense side effects, but it should go away. It should go away in 2 to 3 days. And sometimes you might not experience any of this at all, and you'll be good. Okay, allergic reactions. So, allergic reactions. If there's any allergic reactions that's going to happen, it's usually going to occur within 15 minutes. The first 15 minutes is, if you're allergic to it, it should happen in the 15 to 30 minutes thing. Usually when some people have some kind of a reaction on the first dose, they will usually keep you in observation for 30 minutes on your second dose. So allergic reactions, it can happen within that and up to the first 4 hours of the administration of your vaccine. But most of the time it will happen within the 15 minutes. That's why if you go to a clinic or if you take your vaccination in the hospital, they will usually tell you stay with us for 15 minutes and you will be observed. Now, I can't say what happens in the drive-through vaccination centers because I don't have that experience what they do in there, so I don't know whether there's some kind of observation that happens. But just be beware that if there's any kind of allergic reaction that's going to happen, it's going to happen in the first 15 minutes. And not all allergic reactions are severe. There's this one. A lot of the time you really need to worry about if you're starting to get like short of breath, anytime you experience any kind of respiratory distress, you're wheezing, you have stridor, kind of like vibrating noise because your windpipe is getting obstructed due to the swelling. You have hives, red and itchy swellings on your skin. You have angioedema, you're swelling under the skin. So like if these kinds of allergic reactions you have, it's, this is what you call like severe, So a lot of the times, if you are being observed, they might give you some Epipen, and they will call 911, or and they take you to the nearest emergency room. And some people, if it's not severe, they just tell them to take Benadryl, or some people they just take Benadryl when they get home. So it depends. So not all allergic reactions requires Epipen. So it depends. That's why you are in there for 15 minutes, so that they can determine what kind of allergic reactions you have. Okay. So next one is, let me see. Okay. Okay. So my experience as far as symptoms is that on my first dose, all I really have is soreness at the injection site that lasted for 24 hours, maybe not even that, because I got my shot in the morning and I was fine until the evening that I got home. That's when I felt soreness at the injection site. And then it went away like the next day in the afternoon. So that was it. And then I got like a mild headache, and I also experienced some itchiness at the injection site, and on and off for the first few hours. Again, it went away. So the second dose, I also had soreness at the injection site. It was worse than the first, but it lasted for 3 days, but it was diminishing each day. And headache, that's it. I just took Tylenol with that. I did not miss any work at all for both of my doses. And I had a Pfizer BioNTech vaccine. I did not get the Moderna. I got the Pfizer. That's what they offered at work. Okay, things to remember. Just remember that it takes about 2 weeks for the body to build up antibodies. So if you had any reaction from the first dose, make sure you also check with your provider before the second one, just to be on the safe side. Going back to the 2 weeks. Okay, so if you get your first dose, don't go out in there thinking that you're already immune, because it takes your body a good 2 weeks to build up your immunity. And if you only have got your first one, even after 2 weeks, you still don't have the full dose anyway, so you only get half of it. So you're probably only like 50%, 45 to 50% protected. So you still have to maintain your social distancing and always wear the mask, wash your hands often, or use the hand sanitizers. So hopefully this information is helpful for everybody. Please don't be scared to get your vaccines. Yes, you will have some side effects, but the side effects will go away. And, it's really good to be vaccinated. Then you don't have to worry about anything else. You don't have to worry about getting infected. You don't have to worry about infecting your family members. Okay, so I hope this is helpful again. And please like and subscribe to my channel. And talk to you next time. Thank you. Bye-bye.